Hi, everybody. This is the second in a series of health talks that we have had with Christine Roche, who is an expert in microbiome, immunity, and a number of other things that help keep masters well and thriving. And we welcome you today, Christine. Thank you for taking the time to meet with us.
Thank you.
And we look forward to a rich sharing of being able to understand what it is that you know that we can do to optimize our health, especially during the COVID period, and really immunity building for any time in our lives. So this is about an hour-long interview, and I'm going to take a novel approach to having you tell us what your biography is or whatever the highlights of your long experience in this field and other experiences that you feel are pertinent to our audience knowing about you. So would you just take a couple minutes and do that for
Yeah.
us?
Thank you, Megan and Diane. It's a pleasure to be here. Well, I started out at Stanford Hospital. I worked there for many years in the primary care department and in many other departments. And my background is actually that I have a lot of information on 2 degrees in public health and also in clinical psychology. And I worked for 15 years in the functional medicine clinics in both Europe and the United States. I've written 2 books in the process, and I have trained with some of the leading doctors over the last 20 years on the microbiome and specific aspects of enhancing our immune system. It's all started back when I was working at Stanford, and the patients who were interviewed would say, well, after 2 years, I'm still struggling and there's no results. And so they wanted to know what the root cause was of their problem, not just take a medication. So that's when my journey started. I was invited to become part of a functional medicine clinic. And from there on, I worked together with a team of functional medicine practitioners.
Well, both Megan and I have had the benefit of your good care, and so at some point during this discussion, we'll be sharing those perspectives with you as well. So I'm just going to jump right into the subject matter so that we can build a context for your comments and your suggestions. One is, what is functional digestive health?
The main part that's different is that you're looking at how your digestion is functioning rather than looking at what diseases you have. So in functional digestive health, as in functional medicine, we're looking at what are some of the causes of the digestive issues you have, whether it's heartburn or it has to do with pain or bloating or gas. It's looking at the roots of the tree as opposed to just looking at a branch and saying, there's a diagnosis here, you have a specific condition. We're looking at more than just what is going on. We're looking at diagnosis. Of course, it's very important. We're also looking at what is causing that diagnosis.
Okay, so we know that you specialize in gut biome, and we're interested in knowing what that is and what does it contain? How does it work? What part of our physiology is microbiome?
So
Thanks.
I want to give you a little bit of a background to compare the microbiome with the Greek islands, for example, where children that are born naturally, and then as soon as they're born, they're breastfed, so they're getting a very healthy introduction from their mother's microbiome, because when each child is born, they immediately get inoculated with the most important part. And then also they're immediately going into a community that allows them to play in the dirt when they're growing up and so on. And so when you take a boy, I just call him Nico, from those islands, what he's actually, as he's growing up, is that he's continuously patterning a new microbiome based on the soil around him, the environment, and that includes not just the digestive system, it includes the mouth, the nose, the throat. Every organ of our body has different species of bacteria that really help us, different species of viruses, actually, different species, we're inhabited with billions of microorganisms. So what we didn't even know about is that we live in a symbiotic relationship with these microorganisms, the community supporting each other, which in COVID time, we know how important that is. So we are actually inhabited by 100 trillion microorganisms. It's 10 times the number of cells in the human body. The microbiome has 150 times as many genes as we have, and coexists with gut pathogens, regulates the immune system, regulates the endocrine system, and most importantly, helps us to digest and absorb our food. It turns out that if we do not have the right combination of bacteria, we're unable to digest and absorb and eliminate in the way that we need to, including detoxifying toxins. So the difference is Nico, right, was raised with a natural birth, and also in that culture, children get a lot of fermented foods from the beginning. And so he's not really exposed to any chemicals. They have really clear air and water. And then I'm going to talk about Carolyn, who's born in New York, C-section baby, which from the very beginning, when you do a C-section, which is sometimes necessary, but she's not getting the connection with the microbiome from the moment she's born. She's not breastfed. And at the age of 2, she has an ear infection. And so she gets an antibiotic by her doctor. And lo and behold, 2 years later, she gets another antibiotic. Whereas Nico is being fed really natural honey and other herbs as he's growing up, so that he's training his immune system with natural substances. Antibiotics are very beneficial. I'm so glad that they are here and working at Stanford Hospital. I certainly experienced some incredible things with that. However, what we do now is we prescribe them for children, the children I see, as if they are just a part of life. Every year they've had antibiotics, and what that does is really affect the terrain, the inner terrain. So by the time Nico was 10 years old, he had no infections at all. He was thriving in the garden. He was eating organic food from the plants, and he was mostly fed really clean water, food, and was also in a symbiotic community. Carolyn, on the other hand, after getting 5 years of antibiotics, was eating primarily white flour, white sugar, the standard American diet. So by the time she was 15, her microbiome was so disordered that she started to get some symptoms of severe constipation, acne, skin disorders, which are so common. She started to have a lot of issues with her digestive system, and eventually developed heartburn and had to be on many medications. So by the time she was 30, she was quite ill, and Nico was thriving in his environment, in his village at the age of 30. So just a little background of how we interact, our microbiome interacts with the water we drink, the food we eat, the environment, the social aspects of what we're experiencing. So it's continuously changing.
Thank you. That's a really nice contrasting way to build the story of microbiome. So in addition to those factors, the water, the medical attention, whether it's antibiotics or natural healing, soils, whether they're original soils or they've been chemically treated or whatever, in addition to those sorts of things, what else are the issues of microbiome in modern world today?
Well, I think a large part of it is the spraying of pesticides and herbicides on our food, and also how we treat the soil. Because it turns out that whenever we eat food, the soil bacteria is what prepares our microbiome for whether or not we're going to be digesting in a healthy way. So the key is that that one of the things that's so altered is that instead of using natural fertilizers and using permaculture, which some of you may know, or other kinds of biodynamic farming, which I studied in Europe with Rudolf Steiner's teachings, where there is a real attention to the soil microbiome being transferred to us through the vegetables, through the food. Unfortunately, we have done over the last 100 years, significant damage to the soil. We have done so many changes that the nutrients in the soil are maybe half of what we used to get. There are industrial pesticides and herbicides and genetic modification, which what happens is it significantly altered the landscape of our microbiome, not just in the gut, but it transferred into every area of our body. Also, the number of C-section, the number of medications that people were given. At the clinic I worked with, the average person had like 5 meds. So the meds interact with the microbiome, and we were able to rectify that. However, people were eating sugar, 10 pounds of sugar a month, the effect of environmental toxins that has increased 100-fold. Also, the genetically modified food, and then the person's own genetics. So it's many different factors.
Thank you. And if you had to pick the most critical one in your opinion, what would you say that is and why?
I think it is the environmental pesticides and herbicides. I think that's one of the most critical factors.
Okay, well, one of the issues that we pay attention to in the community is GMO. So we're right there with you on that. So would you please explain the connection between the microbiome that we have in our digestive systems, the gut microbiome, and the immune system that we have, which is designed to fight off infections and whatever, any kind of pathogens that we might have? Thanks.
So to answer that, I'd like to tell you a little bit about what those bacteria in our gut do and how they interface with the immune system. So, we have, as I said, hundreds and thousands of different species, and they actually regulate the metabolism of our cholesterol. They help us detoxify our poisons. In order to eliminate and detox properly, we really need a good amount of the right bacteria. They maintain the pH balance of the stomach, reduce inflammation, and they also are critical in making anti-tumor factors. So in other words, besides reducing inflammation, which is one of the core root causes of chronic disease, is that they're actually all of these synergistic microbial landscape inside of our gut and in every organ of our body basically has to do with actually our immune system and making, so for example, they found in cancers that people who have a really healthy microbiome do much better because again, it affects how these bacteria express themselves and whether or not they're able to make anti-tumor factors and anti-inflammation. And if they're not in balance, then that is compromised. So I wanted to give you that as a background.
Yeah, and I've heard that there is a percentage of our immune system that is in the microbiome. Is there a number that you can share with us that way?
Yes, I would say that about 80%, 80 to 90% of the immune system is in the digestive area, and it's actually called the secretory IgA, which is the gut immunity can be measured now through functional gut testing to see what the level is. And for example, one of the things that might happen to Carolyn is that she's eating certain foods that her immune system overreacts to. So she would have an extremely high secretory IgA showing she's allergic, she's reacting to gluten, to dairy, to other things. And very low CGA would affect whether or not we can do an appropriate immune response. So it is, that's one of the things that's so great about functional health is that having worked with, thousands of people over the last 25 years, I have found that it's really effective to be able to see, well, what's really going on? How do certain foods boost the immune system? And what is going on with the history of a person? For example, if you've had a lot of antibiotics, sometimes what happens is, or you're taking many prescription drugs, is that the tight junctions in your small intestine become affected and start to come apart a little bit. And so that is a key player in autoimmune disease. So again, whether it's too little or too much immunity, when the body becomes reactive to the point where it attacks different organs, there is always an effect that happens in the digestive system with the tight junctions starting to come apart.
Okay, there's so much to talk about here. It's really interesting. So I'm wondering about the prevention of viruses, bacteria, and fungus that, when you go into the world of microbiome, that is what makes up the microbiome plus, plus, plus. And yet there are certain fungi and certain bacteria and certain viruses that we don't want to get, we don't want to experience. So how does this all relate in the microbiome?
Well, the most recent research by a gastroenterologist, Dr. Desi, Desi, showed that healthy gut bacteria promote the functioning of T cells in the body to identify the invaders and to kill them. And that unhealthy bacteria, a bacterial overgrowth in the digestive system, is not able to fight off the invaders. So in other words, the microbial landscape, which includes having the right amounts of different fighters for the immunity, one of the most recent study, which is very exciting, actually shows that the research is there's a strong connection between the gut flora and the protection of lungs from viruses. So for example, in order to shield our mucosa and boost the immune function, different types of strains of probiotics have been shown to colonize the gut, also colonize the respiratory tract. And so they've done a study where they actually looked at people who were taking those probiotics, and then they put them under a lot of stress and gave them a flu virus or a cold virus in the study. And this was large groups of people. And when the people that were able to colonize their gut and actually took the probiotics during the virus time had flu and viral illnesses reduced by 75% in the studies. And in the same way, what is very impactful is that in the COVID era is that the studies show that the most recent one is that the level of COVID, including whether or not someone gets the long hauler syndrome. Many of you know that COVID not only expresses itself at the time you have it, that many of my clients and friends and colleagues report months of symptoms now after the COVID. There is a strong correlation between a low functional microbiome that has the right bacterial composition, meaning it does not have bad dysbiotic bacteria that's overgrowing. So I'd like you to think of a garden. Let's say you've tilled the soil and you have beautiful flowers in the garden and weeds grow, right? So what the dysbiotic bacteria is when there's not enough of the good bacteria because we've killed off in this culture so much of the good bacteria through drugs, through stress, through the environment, through the air, the water. When you don't have enough, then what happens is the weeds start to grow. And these are dysbiotic bacteria that take over the garden. And in that situation, COVID can easily take hold because there's not that your landscape is less robust to fight it. Does that make sense? I mean, it's really like a sense of cultivating the optimal landscape terrain. That's what Hippocrates said, all of the root of all disease is in the gut. Well, it's also every Swiss and German doctor I worked with said it's the terrain, it's not the virus. So how COVID expresses has to do with our internal immune system, our inflammation factors, and the gut microbiome is playing a critical factor. If we have a garden full of weeds and we're highly inflamed, that is the reason why the United States has the highest death rate of any country in the world, is because we are so inflamed. Because what we do is we are unfortunately highly toxic by what we eat and how we live our lives.
And that too would explain why certain people come to difficulties with the virus, and other people may be exposed to it and not succumb to the disease.
Yes.
So what can we do to enhance or to boost our immune system? And how, when we do that, how does that affect the whole body?
Well, I want to just say one more thing, Diane and Megan, is that this in the Spanish flu, which was, devastating, as you all know, it turns out that some people who cared for others did not get it, even in close contact. And I have several doctors I work with who were in the room with COVID patients before they knew they had COVID, even before, a little bit before the COVID era, who did not get it. And then I know a lot of people who are in their 90s who just went through it and said it was okay. It was like a bad flu, but I'm fine. So again, the inner terrain, I wanted to put that in the context, because what you can do is not so much a simple one-word answer. In the US, we expect it to be, well, this is, you cultivate your garden and you're done, right? But what it really is, it's about really being in alignment with all aspects of being a health master. Being a health master, I'm going to go through some of the things right now, is looking at, for example, when I was working with my clients, looking at the top foods that boost immunity. So how you nourish the terrain, right? So it turns out that by eating fermented foods, which Nika was getting from the moment he was born, right? His mom was breastfeeding him, and then within a few months, he was living from fermented foods grown from, very healthy foods, whereas Carolyn wasn't getting any fermented foods. It turns out the average American eats like a tiny amount of fermented food, whereas people in the cultures that have such robust immunity eat 50% of their food is fermented. And fermented meaning, fermented vegetables in many different forms and things like that, kimchi, sauerkraut. So it's about how you nourish yourself, what you're eating. For example, turmeric is an important antiviral and immune booster. So if you can increase your turmeric in your cooking and spices. The Indian population, I recently spoke with a friend who has many, many people over there that she's connected with, and physicians, and they said they have a much lower rate of certain types of responses to COVID because they cook with turmeric and eat primarily plant-based food. So the important thing is the American diet, right? Standard American diet, white flour, white sugar, gluten, dairy, raises the inflammatory factors to the point where we are lowering our immune potential in that way. So, turmeric, seeds and nuts, sunflower seeds, pumpkin seeds, all kinds of sprouted seeds, a lot of things that are sprouted have so many more nutrients. So we're not really, in this culture, we eat so much out of packages. So people that would eat primarily frozen packaged food versus having the garden. So you're cultivating the garden, you go outside, you smell how the vegetables smell and taste. You enhance your digestion by eating seeds and nuts and sprouts, making sprouts at home, legumes, things like that. We're basically talking about lots of vegetable broth with dark leafy greens, cultured yogurt, with hundreds of billions of bacteria. Coconut cult in our area is an example of a cultured yogurt. People eat a teaspoon and they immediately feel the difference. So there's many ways, but it is very integrated with looking at how you're feeding the landscape. So that's it. But I have many other parts to that. I mean, it's a very, I would say, for example, the research shows in nutrition that one candy bar and soda reduces immune response by 70%. So neutrophils are not able to gobble up the bacteria. I was just stunned. I mean, I had no idea. The doctors and I were giving a talk and we're looking at, oh my God, look at these studies of college students eating 2 tablespoons of sugar in equivalent, in an evening. Doing that a couple of days and then being given a virus. The ones that got the virus, that had eaten all the sugar, were succumbing to the virus. So we are a nation of, eating a lot of sweets. Not that it's all bad. I'm not into the black and white, but just the awareness of, alcohol disrupts the balance of bacteria in the gut. it feeds any bad things that are growing in the garden. Doesn't mean you can't have a glass of wine once a week, or, you know, whatever occasion, celebrate with sugar and wine. It's more that the clients I work with, we're having sugar every day and wine every day and eating, you know, lots of processed food. And so that's what we're talking about. So basically, even caffeine disrupts the bacterial balance, the level of stress you have. The cortisol lowers your immune response. A big immune disruptor is artificial sweeteners. Even Truvia, which has been hailed by Costco to be the new stevia, right, is very much altering the immune system by having these kinds of sweeteners. So, you know, that's another factor. Exercise is so important, walking at least 30 minutes a day. They actually found that when people were outside bare feet on the ground, just like when we put our hands in the earth, that we require time in the sunshine and outside for our microbiome to thrive. That those people that were tested that were always inside had a very different composition of bacteria than those people that were living outside. That's why Carolyn, you know, was living in a city most of the time. She was inside working at her computer like we all do now with COVID. Whereas Nico was spending 80% of his time out in the sunshine and in the gardens. So the food, what you surround yourself with in terms of the environment that you live in is a critical factor. And I just want to mention that electromagnetic frequencies in my studies with the key doctors in Europe and also here play a much more of a major part than we realize. The exposure to cell phones actually has been shown to increase the bad bacteria in the digestive system and diminish the good bacteria.
Well, all of what you've talked about are interests that Megan and I both have. And EMF, the 5G phenomenon, all of that are issues that we are addressing in the Mastery project that we're launching in March. It'll be a 30-year project. So you'll be happy to know that the GMOs and the 5Gs and the EMFs and all on our agenda for masters to take a look at, get really well educated about, and then make very conscious decisions about not only what they will do in their own lives around that, what they will also do in their communities, states, countries, whatever. So let's move now from a contextual kind of thing to what is it that if people want to work with you to optimize their gardens and to figure out how to get rid of the weeds, or at least manage the weeds without pesticides. And of course, this is all analogy or metaphor for our gut biome. So people that would like to move their gut biome into an optimized condition, what sort of things is there testing? Are there supplements? Of course, I know the answers to this because we've been through your program. So please talk to us about an overall approach you would take with just about a generic approach you would take with most people, even though we know that every person you work with is customized and that you tailor everything to each individual. Thanks.
Yeah, and that's exactly what I would like to say is I think that it just to summarize again, you know, what you were asking me about what are the factors, I think it's both the internal thoughts that we think and the environment interfacing. But I think the most important thing I want to mention too is when people drink tap water, they're getting so many chemicals. They're getting so much in the actual chlorine, bromines, chloramines, that those actually also interact. And so I've had people who've said, why is it I keep getting these skin infections, or I keep getting this, you know? So the skin, and then also the gut-brain connection. I've had a lot of people who have been drinking tap water and they have very foggy brain. And then we tested the microbiome and the gut bacteria, and also looked at what was present in the fungus, you know, in the body. And so we found amazing things as far as different chemicals affecting the brain and the digestive system. So I just want to mention that, you know, the food, the exercise, the water, the air, and very specific. When I work with people, I'm doing very specific guidelines for the people. So each person live, I work primarily remotely, of course, during COVID. But an example is I have people who live in LA and I have people who live in Switzerland. And some people just want to do a functional gut test, which is where you collect the stool in your own home. Very, easy to do, gets picked up by FedEx. So people do that even in Europe, they work with that. And so what we do, so that you can test that, why would you want to guess? What I love about functional healthcare is why guess when you can test, right? So that's kind of become my go-to, because what I love is that people actually have found that if they know what's going on in black, in color, in full color, so the test shows them exactly what's out of balance, what's imbalanced. It also shows the state of the immune system, whether they're able to mount a good immune response or not, or are they eating things that are out of balance? Do they have enough stomach acid? So when people go to my website, they'll see how comprehensive the test is. We have examples on what it does. So you may want to test or you may not. What I do with everyone is I do a 15-minute introductory meeting that we do on the phone or Zoom or Skype to get to know each other, and people fill out a questionnaire and we find out what is it that you need and what is the most important thing. So this is all about you. It's not about me trying to put you into a testing or a program. It's all about saying, well, what would be right for you? And some people do 1 or 2 hours of honing in on their nutrition and that's it. And some people do 4 weeks of working with first a test and then 4 weeks of customized, depending on what's found, customized nutrition. And some people say, what I want to do is test for gut permeability. I want to test my adrenals. I want to test my blood because I do functional blood chemistry with a physician. And then it could be 6 months or a year that we work together, depending on what's found. So it could be as little as 1 or 2 meetings. So it could be as much as, oh, let's do one more test. And oh my gosh, I want to really optimize everything. So that could be from 3 months. If someone is healthy, they can easily optimize in 12 weeks or less. And if they have 1 or more medical conditions, or if they are on meds and things, I work in a very integrative way with the physicians that are on my staff. And, we could be anywhere from that time to a year or longer, depending on what they want to optimize. Yeah.
That makes a lot of sense to me. So, did you want us to talk about our experiences at this point, or would you like to talk about something else and then have us share what our health
Yes,
mastery
I
has
think
been?
I'd like to go over a little bit
Okay.
more about, the basic immune boosters. Also, what we're using is herbs. And the more important thing is we use different proven herbs and supplements, which I haven't really talked about yet, that have to do with what supplements show up on the test. So if people respond to something, the test actually shows them. Like when someone has a bad yeast overgrowth, the test will show them which antimicrobial works for their yeast, which would not be the same. And that's what I love about it. I'm not guessing about, oh, you have yeast, you have fungus, you have oxidative stress, you've got oxalates. What do we do? The test will show, and in the blood test that I do too, it will show that you need to go this way. This is what that person's bioindividuality responds to. And that's what I love, because functional healthcare is very different than standard care. In terms of standard care, is very valuable when you break a bone or you need surgery. Incredibly important. The two need to work like hand in hand and glove together. However, standard medicine is focused on diagnostics when there's already a specific disease and drugs to deal with the symptoms. What functional medicine does is look at different ways of assessing what's going on, and then using natural methods as much as possible to get the body to, reactivate a healthy garden and also reduce inflammation and work with these antecedents, where in this test, for example, you can see 10 years before whether or not someone is heading towards colon cancer or inflammatory bowel disease. And this is actually a good example. what I want to share is right now in the American culture, we do one Cologuard or some other stool sample to see the outcome is with colonoscopy and our standard GI testing is to see if the person has advanced disease. Do they have ulcerative colitis, Crohn's? That will show up. What we found, what's so exciting in the clinic, I've always worked with several doctors and other healthcare providers. We actually found people where the scope had shown they were clear during a colonoscopy, and we already detected the small changes in microscopic changes were detected on the test, so that over time you could monitor that and make some decisions. And sure enough, those people later on really thanked us because they were heading towards a severe chronic disease. So the beauty of functional healthcare is that you can intervene at the early stages before it becomes a very costly health expenditure down the road, a serious disease. And so now I'd like you to say a little bit, Megan, maybe to start about your work, what you noticed when you changed some of the things that you changed.
Thank you, Christine. This is so exciting. I love everything you've brought up. I want to go research it. What was helpful for me was keeping a food log and just really being mindful about what I was eating. And then because of the test, you suggested and encouraged me to not do gluten and to not do dairy and to not do wine as much as I was drinking wine. And so I decided to cut out everything that you suggested. And it was just really helpful for me to be much more mindful about my eating. And so now I just have occasional glass of wine. I really am not doing dairy, and I definitely am not doing gluten. And what I have found is just that I enjoy being more mindful about my eating. I don't like taking pills, and so it's been quite a journey for me just to say, look, I know this is healthy for me to take my supplements. And so I have noticed again that I haven't actually felt a lot different, although I've dropped 15 pounds, which is really nice. And I'd like to lose a bit more. But the whole process has really helped me to drop weight because I was eating too much dairy. And so I'm really grateful. So I'm feeling better, I'm more mindful, and I lost some weight, which is a wonderful bonus.
Thank you, Megan. That's quite an accomplishment, 15 pounds. And also what you were saying, you think you noticed the difference. You mentioned something when we talked earlier about something about symptoms going away or just being clear after going off the gluten or having more energy, or there was something that you noticed.
Yeah, I mean, I have a lot of energy anyway, so I didn't notice that I got more energy. It was just that I feel more integrated and mindful about what I'm actually eating. And so for me, that was important because it's gotten me more embodied around that and mindful. Thank you. So Diane, how about you?
Well, I've been paying attention to this sort of thing, microbiome and biodynamic farming and organic farming for probably 30 years now. And I've done fasts, I've done vegan eating, vegetarian, paleo, you name it. And I'm not one of those people that does something for 3 weeks and then stops and says, I've done it. I'm a 3-month minimum. And in case of veganism, it was about 3 years, and it was all organic, and it didn't suit my system as much. By my blood type, basically, is the way that I see it. So when I was introduced to you, Christine, here in California, and you were available to work with me this way, I was absolutely thrilled. And what it's done for me is that I am now very deliberately not eating dairy, which I used to eat lots of every day. And I know about the dairy industry in the United States. I have just come from spending a lot of time in Europe, where dairy and wheat is not as corrupted as the foodstuffs are here. And so I just went ahead and, I was mindful, but I wasn't as mindful as I am now. And I think the other things are that, it's just a really helpful reminder to have somebody who really knows what they're doing as a thought partner, as a person that you actually honest with about what you're doing if you really want to make it work. Sometimes it's helpful to have somebody there to prompt you to be more honest with yourself about what you're putting in your mouth, or whether you're going out for a walk or not, or whatever. So I think the thought partnering is a huge component of what you do, for your clients, from my own experience. And I found the testing to be quite useful as well, because I really was not aware of the detail to which we could examine the microbiome. I find that fascinating. So lots of other things as well, but in the interest of time, if you've got other things you'd like to tell us about how you work with people and what you find is most successful, how people can optimize you as a thought partner and as an advisor, let's just
Yes.
give you a few more minutes to do that, and then we'll wind up. Thanks.
Okay. Thank you, Megan and Diane. And I would like to say that it's very much people consider me to be a partner in their health, that from the very beginning, there's a commitment that they are interfacing with me in a partnership where they will let me know, we will put everything in writing, what the goals are. For some people, that's very important, but they determine the direction, and it's all individualized. And what's so great is the blood testing, which I've only done the last couple of years, identifies also hidden areas that people were not aware of. So by doing the blood, first they do the digestive test, the microbiome, then the blood test, and then we sit down and really look at, well, how does it look and what is it again in the partnership? So it's all about them being able to optimize their health by changing maybe a small step. I have a lot of background in behavioral psychology, so there will be coaching around tiny steps and totally being accepted with those tiny little steps until they're ready for the next step. So it's all about the person choosing what steps they're willing to take, what feels right for them in what sequence. And then, being able to have, as you said, that touch point, that ability to partner and be accountable. Many people call me just to say, I want to be accountable every day. So, yeah.
So Megan, do you have anything you'd like to add or ask? Or I think we're coming to a very nice organic ending here.
Well, speaking of organic, yeah, I just would love people to try this out and to get to know their microbiome and to be more interested in it. I mean, it's fascinating that we have these creatures living inside of us that we're symbiotic with, or that they're symbiotic with us. So just getting to know more about that. And like you said, I really took what you said to heart, Christine, about the inner landscape, which has to do with my gut microbiome, but it also has to do with my thoughts and my feelings, and staying clear and healthy emotionally as well. So I think that's a wonderful thing to add. Thank you.
That's great. Thank you, Megan. And the next step would be, if people would like to contact me, I do that 15-minute introductory meeting with you on Zoom, Skype, or on the phone. Please call me at 650-856-3151. And my website is www.digestivehealth.center. So the one word, digestive, HEALTH.center. And I welcome your calls, or just going to the website, fill out the contact form, and then we sit down for 15 minutes and we explore what it is that's most important. So again, the number is 650-856-3151. I look forward to hearing from you.
Great. And just to make sure that everybody understands that the website is .center, not .com, not .center.com. It's .center, just like ancient future .today.
Yeah.
So it's digestivehealth.center. And we will be listing those details around this video as we put it out. And we look forward to hearing from our masters. And we ask anybody who does work with you to feedback a loop to us about their experience and how it's going and what they're experiencing, so that we can stay connected and make sure that our mastery community is building masterful health. And so we really appreciate, Christine, that you have stepped in and said, let's partner on this and see how this works for your community. So this information will be going out before our launch, and which is the launch on the 20th and 21st of March, which is our 30-year project announcement. So you're right in here with our winding up into the next 30 years of what we'll all be doing together, hopefully. So welcome, thank you, and continuing to know you in the years ahead as well.
It's been a great pleasure. Thank you so much, Diane and Megan.
All right.
Thank you.
Bye for now, everybody.
Bye.